Hi, good afternoon. My name is Dr. Richard Jin, and I'm here speaking on behalf of Benev on their exosome regenerative complex. Thank you for taking the time, and I hope you enjoy the presentation. We're here to talk about Benev's exosome regenerative complex, and the proprietary information and all this science is derived from Exosomes, one of our close partners in South Korea. They are, in fact, one of the top exosome research companies in the world today. In terms of exosomes and where things are going, this is one of the hottest topics right now in terms of therapeutics, but for our purposes, we'll be talking more about aesthetics. In terms of the exosomes and how popular it's getting, this slide just shows the number of primary articles that are being published on exosomes in terms of basic science as well as clinical therapeutics, and where Exosomes stands with respect to exosomes. So what are exosomes, right? And I think this is very important to understand. So one key point to take away from exosomes are that they're nanoparticle-sized vesicles that are naturally released by proliferating or growing stem cells. What's really important to know here is that these vesicles, or the exosomes, are the ones that contain all the therapeutic potential that we once thought that the stem cells harnessed, right? In essence, exosomes are the most important factors for cell-to-cell communication, meaning they have all this information that are released from one cell that travels to a neighboring cell that helps it proliferate or activate downstream processes. Again, in terms of the exosomes, they're nanoparticle sized, 30 to 200 nanometers. They contain various things such as lipids, proteins, mRNA, microRNA, and in essence, they are the cell-to-cell communicators. In terms of classes of extracellular vesicles, this slide shows exosomes versus microvesicles versus apoptotic bodies. Again, exosomes are composed of a lipid bilayer, which allows it to freely be released from a cell and freely uptaken from a neighboring cell, sharing all the genetic information. Again, here, this is just showing size-wise comparison of exosomes to proteins and bacteria, platelets to regular cells, and it shows that they're quite small in nature. In terms of the process of purifying the exosomes, we go through quite rigorous studies to be able to show that from our adipose-derived mesenchymal stem cells, this is where the exosomes are coming from. But in order to be able to verify what they are, we look at certain markers. We look at cell surface markers and such as CD63, CD81, and other housekeeping proteins to verify that we have a pure concentration of exosomes in the exosome regenerative complex. This here, right at the bottom right, the cellular uptake, this basically shows, that's actually a confocal microscopy slide of a fibroblast cell, and basically shows those little green dots. Those are exosomes being taken up into the cytoplasm of the actual fibroblast cell, interacting with the nucleus directly. So exosomes, like what do they contain and why are they so, what's the big deal about it? And, people talk about it containing growth factors, but this slide actually shows that exosomes, these exosomes in particular, contain over 50 growth factors. And I'm sure to most of us in the audience, we're very familiar with like EGF, FGF-beta, IGF, VEGF. These are just very common growth factors that have been shown to have therapeutic potential. What's amazing is that these small nanoparticles, these exosomes, actually contain over 50 growth factors in themselves. In addition to the growth factors that they contain, exosomes also have anti-inflammatory properties. So not only can it help generate more collagen, more elastin, but it also helps with inflammation. So that's where it's great in terms of treating some chronic inflammatory states, as well as, if we use some types of modalities to help in our treatments, it helps with the downtime, decreases the redness. In terms of, the actual production method, this basically just shows how the exosomes are produced. They come from proliferating adipose cells, and they're filtered there's 2 stages of filtration, and then you end up with pure exosomes at the end product. And they're lyophilized, meaning they're basically freeze-dried, which increases stability and kind of duration or longevity of the exosomes. This here is just a slide showing the facility. And the method that the exosomes are actually produced or purified are through tangential flow filtration, TFF, and that by today's standards is the way to go. It's the gold standard in terms of being able to get the highest purity and the purest population of exosomes in any type of media, versus ultracentrifugation, which was a spin down method, but you'd end up with a heterozygous population of cells and not pure exosomes. This here is just showing that lyophilizing exosomes basically doesn't harm them in any way and shows that they're still viable afterwards. Here in terms of the preservation, just showing the particle concentration using different types of modalities or different temperatures, looking at particle size over time. Here's the concentration, here's size over time, and shows that through this method, that the particle concentration nor the size changes over time. Again here, basically showing that purified and lyophilized exosomes from various different sources, the method that we use is pretty much the gold standard. Now, exosome protein profiling, we already talked about how they contain over 50 growth factors. We talked about anti-inflammatory properties that they have, but they have also other ones as well, including anti-aging, preserving and rebuilding the skin barrier, which is important in what we do, as well as wound healing. In terms of the constituents of the exosomes, we talked about growth factors, we talked about anti-inflammatory properties, but they also contain microRNA, which are short non-coding RNAs that basically are involved in anti-itching, proliferation, anti-inflammation, maintaining the skin barrier, anti-aging, etc. So basically, this just kind of outlines and shows that exosomes not only help cells grow, not only has anti-inflammatory properties, but also has microRNA that have other therapeutic beneficial properties as well. Conditioned media versus purified exosomes. So a lot of us have probably over the years used conditioned media, and some of us probably still do. And to be honest with you, conditioned media works well. We have cells that are proliferating and are releasing growth factors into the media that are, so the media is rich in growth factors and other cytokines that we use for our topical treatments and work really well. But this slide here basically shows the differences between the regular conditioned media, enriched conditioned media, and in our case, Beneb's exosome regenerative complex, which are purified exosomes. Basically, these purified exosomes, you don't have any cell debris, you don't have any components of media, you don't have any antibiotics or waste products. You have a very pure population of end product, which are the exosomes. So moving on to skin regeneration with exosomes, this slide here, it's a technical slide. It's showing confocal microscopy, showing keratinocytes on the left, fibroblasts on the right. We have exosomes that are labeled with green fluorescent protein, and shows that how easily they're taken up into the cells, right? You see those green little specks here on the left, and these green specks here on these fibroblasts on the right, shows that these green specks are able to be taken up into the cells readily and very easily, thereby exerting a more robust and quicker therapeutic effect, right? This again here is just looking at collagen synthesis as a function of concentration, shows that we have increased collagen synthesis as a function of concentration. The more exosomes, the more collagen. And this shows uptake here on the left side. So it improves neocollagenesis upwards of 6-fold, right? This here basically shows the elastin amount, right? Not only do we have collagen, but now we have elastin, and basically shows in our cell culture studies that our exosomes are able to increase the elastin amount upwards of 300%. In terms of cell proliferation, we're able to show that it increases cell proliferation by upwards of 80%. These are in human fibroblast cells. In terms of reepithelialization, wound care basically shows that with the exosome regenerative complex, you're able to rebuild the epithelial layer and thereby having quicker or shorter wound healing. In terms of anti-inflammatory properties, I'll go through this pretty quickly. There's some chronic conditions in terms of atopic dermatitis. Animal studies basically shows that exosomes have anti-inflammatory properties. In terms of skin barrier reconstruction, able to show that, again, in a mouse model, that we're able to increase hydration, decrease water loss in these studies. And in terms of anti-inflammation, also has anti-inflammatory properties. And lastly, in terms of topical skincare modalities, what I like to use, I use a lot of microneedling, RF microneedling, lasers, basically aids in cell proliferation, shorter healing times, faster healing times, increased collagen, increased elastin, enhances skin rejuvenation overall. Basically, the Benev exosome regenerative complex comes in 2 vials. One vial has basically purified exosomes here. Second vial is a diluent or regenerative complex. It's a beautiful complex because it's composed of hyaluronic acid, peptides, other vitamins, other anti-inflammatories, okay? The product has a 2-year shelf life that you keep them separately at 4 degrees and you basically reconstitute or you mix it together. In terms of the stringent quality, they're all tested for viruses and they all come up with negative. In terms of quality control, again, looking for bacteria, viruses, we are very stringent in our controls to know that if we're applying this topically, we feel very safe and reassured that it's a very pure product. This is just a list of the number of exosomes, 2.5 billion, along with other growth factors and peptides. And these are just a couple different modalities you can use, a roller, microneedler, and here's just a before and after proof of concept of atopic dermatitis. 2 weeks after application of exosomes shows much improvement. Again, microneedling, 6 weeks afterwards, before and afters. And then this is an aggressive laser procedure before and after. So post-laser care works beautifully. Again, post-laser care on another patient works really well in terms of the downtime and also wound healing. Redness, erythema, again, before and afters. Acne works very well with our different modalities. Again, microneedling or RF microneedling, as well as other acne. And then redness. Again, more acne and other post-laser care. And I just want to, here's something showing ROI, but I just want to emphasize that the science and all the work that goes behind these exosomes. We, Benev, myself, Dr. Jin, we're partnering with Exosomes to constantly produce and publish both basic science and clinical reports, a couple of which are more recent in publication that I'm authored on, and we're partnering with, Benev as well as Exosomes. Again, in terms of skin rejuvenation, peeling, time frame, this is just a quick look at it. And again, I think exosomes are the next big thing. It's here now. In the past was nutrients, growth factors, stem cells, but now it really is exosomes because these are the ones that harness all the therapeutic potential, combined with the diluent with all the other growth factors, amino acids. It's a combination that everyone should be using in your clinical practice. And these are just a list of the patents, and thank you very much.